Hello, everybody, and welcome. We'll give everyone a couple of seconds here to get in the room and get settled, but I wanted to welcome you to today's webinar. Oops. My name is Gina Petty, and I am the Executive Director of the Sudden Cardiac Arrest Foundation, and I'd like to be the first to welcome you to today's webinar, Heart of the Matter, Real Stories of Life-Saving Action. For those who may be joining us for the first time for a Sudden Cardiac Arrest Foundation event, a little bit about us. We are a national nonprofit organization focused on raising awareness of sudden cardiac arrest and promoting initiatives to help save lives through education, research, and community. And our vision is to eliminate preventable death and disability from sudden cardiac arrest and support those who are affected by sudden cardiac arrest. We are grateful for all of our supporters and partners who are listed at the bottom of the screen, so thank you. A couple of our key initiatives are really focused on supporting survivors and those affected by sudden cardiac arrest, as well as raising awareness through education and outreach. We have the Cardiac Arrest Survivor Alliance, the Call Push Shock campaign. We are a co-host of that effort. We host various awards and recognition programs, raising awareness. So we are in our June National CPR and AED Week campaign right now. We have a Heart Champion program, which I'll share about later, and we really strive to be an information clearinghouse for all things related to sudden cardiac arrest. More information is always available on our website. And we're here this week to host this special webinar in recognition of National CPR and AED Awareness Week. And our theme for this year's campaign through the Sudden Cardiac Arrest Foundation is "It Starts With You." So please do visit our website and you can learn more about the campaign, and I'll have some information up on the screen later too. I wanted to, just thank everybody for your time to attend today's session. It really is focused on people who are at the heart of the chain of survival and those who have stepped forward in those critical moments to help to save a life and take that life-saving action. So these are real stories from everyday people who have stepped in to make an extraordinary difference in saving a life, including those of loved ones, students, and even complete strangers. Through their experiences, we'll explore what happens in those moments and what helped them to act and what bystander intervention truly means and how it saves lives. Before we begin, I did want to acknowledge that some of these conversations may be emotional and very emotionally meaningful. While our panelists today are sharing stories of survival with positive outcomes, we recognize that every experience of sudden cardiac arrest is different, and everyone has different experiences, and some stories may resonate in unexpected ways. So please do take care of yourself today during the session. If you need to step away, please feel welcome to do that and take care of yourself, or take a pause and whatever feels right for you. So without further ado, would love to welcome today's panelists. I'm so honored to have these four wonderful people joining us today to share their stories. And yeah, I would love to welcome them. So each of them will introduce themselves briefly and then we'll dive into the discussion. But I'd love to introduce Rebecca McLaughlin first. Hi, Becky.
Hi, everyone. Thank you all for being here. My name is Rebecca McLaughlin. Everybody calls me Becky. I am a registered nurse, a wife, and unexpectedly a rescuer. Earlier this year, my husband Mike suffered a sudden cardiac arrest in our home. It was secondary to a lethal rhythm called torsades de pointes. And I found myself performing CPR on the person who is literally my world. I never imagined I would find myself in that situation. And even with a healthcare background, there is a tremendous difference between understanding CPR professionally and performing it on someone you love. And what I'd like to share today is the perspective of responding in a deeply personal and emotional emergency, how training helped me to act when seconds mattered most, and what I've learned since that day. I am thoroughly honored to be here with the Sudden Cardiac Arrest Foundation and alongside these incredible panelists, and I am tremendously looking forward to our conversation today.
Thank you so much, Becky. Next, I'd like to welcome Kathleen. Hi, Kathleen.
Mhm. Hi, I'm Kathleen Simonetti. I live in New York. I'm a mother of two and a former volunteer emergency medical technician or EMT. So when my son Noah was 10 months old, I performed CPR on him after hearing gasping sounds over the baby monitor in the early morning hours. So that morning marked just the beginning of our journey, as he later experienced three more cardiac arrests at 18 months old while in the hospital, which eventually led to a rare disease diagnosis at 2 years old called PPA2 deficiency. So PPA2 is a mitochondrial condition in which the first sign is often sudden cardiac arrest. So as the parent of a child, not just with a rare disease that increases his risk of cardiac arrest, but of one I've had to perform CPR on, it's changed the way I view emergency response. Emergencies are no longer like abstract possibilities or something that only happens to other people. Having experienced it firsthand, I now know that it could happen to anyone, any age, anywhere, and at any time. So I'm so grateful to be a part of this webinar today, and I look forward to sharing a little bit more of my story with you later.
Thanks so much, Kathleen. I would next like to welcome, oops, I'm sorry, I stopped sharing my screen. Stephen Theall. Thanks, Stephen.
Yeah, thank you. My name is Stephen Theall. I currently serve as the Director of Professional Learning and Curriculum for the Tracy Unified School District in Tracy, California. We're about an hour and a half east of San Francisco and about an hour south of Sacramento in the Central Valley. But in my story that I'll share in a little while, I was the principal at Art Freeler School, which is a transitional kindergarten through eighth grade school in our school district, where we had an eighth grade student, Heather Freely, go into sudden cardiac arrest in her fourth period Algebra 1 class. So I'll be able to share some of that experience, some of the training that had taken place just a couple of weeks prior to Heather having her sudden cardiac arrest, and what the role of our school's emergency response plan was, and ultimately helping save Heather's life. And she's actually serving now as a youth ambassador for the Sudden Cardiac Arrest Foundation.
Yeah. Thanks so much, Stephen. Welcome. And last and not least, I would like to certainly welcome Shannon Walter. Hi, Shannon.
Hi, Gina. And thank you, Gina, and thank you, Sudden Cardiac Arrest Foundation, for hosting this webinar today. Hello, everyone. My name is Shannon Walter. I live in Illinois, and I am honored to be here today. I will be taking the perspective as a community responder. So a number of years ago, I received a pulse point alert, which is actually an app on my phone notifying me that somebody was in sudden cardiac arrest. The county where I live subscribes to the app. And I had been a CPR instructor for many years and connected with one of our hospitals, and had the app on my phone. At the time, like I said, I had been an instructor for many years, and had taught countless people how to respond in the event of an emergency, but never had actually performed CPR on a real person myself. So that experience really changed my perspective on the power of training and technology and community response. So like I said, I'm here today as a community responder, and I look forward to sharing my story a little bit later, and how individuals can, like community responders, can help people in those critical moments until like EMS gets there, and how we can step forward and help even strangers and people that we don't know.
Awesome. Thank you so much, Shannon. Before we jump into our discussion, I wanted to just do a couple of housekeeping reminders. So everyone here, you should be able to introduce yourself in the chat as well if you'd like to chime in for all of our attendees and just share your name, where you're joining from, and kind of your role. Feel more than welcome to introduce yourself. If you have questions, we will be doing a Q&A session at the end of the chat with each of our panelists. So if you have questions that arise throughout the presentation, feel welcome to put them in the Q&A section of Zoom, and we will get through as many as we're able to in our time together. So please feel welcome to engage in that way. And now I'm happy to kind of jump into our discussion. So we're gonna have each of our panelists share a little bit more about their story, their experience, and their perspectives. So we're gonna start with Becky. So as Becky has shared, we know that the sudden cardiac arrest that she experienced of her husband happened at home, which we know in sudden cardiac arrest, typically about 70% of the time it's going to occur in the home. And as she shared, even though she's a nurse, she never before performed CPR, especially on somebody that is so important to her and someone that she loves. So I'd like to welcome you, Becky, today, and just kind of take us through what happened that day and what it was like for you to step into action to help to save the life of your husband.
Hi, all. All right, before I start, I do want to mention I do have notes. So I will say no matter how many times I share this story, it still gets emotional. I don't think that's ever going to go away, and that's okay. So if you see me glancing down occasionally, that's why. As Gina said, when people think about sudden cardiac arrest, I think a lot of people imagine it happened somewhere dramatic, like in a hospital or in public. But in reality, most sudden cardiac arrests happen at home. And that's exactly, excuse me, and that's exactly where ours happened just this past January. One moment, my husband Mike was standing at the kitchen counter talking to me, and the next he was on the floor, and I was alone. There was no other family members in the house. In an instant, I found myself running a code on my husband completely by myself. And honestly, my very first thought was he was having a seizure. It looked like he was having a seizure. And I think that's important to talk about because sudden cardiac arrest did not look the way I had expected it to look. Very quickly, he began turning blue and developed agonal breathing. And as a nurse, I recognized what agonal breathing was. And even with that knowledge, it still scared me. I still created a moment of it created this moment of confusion. And if I'm being completely honest, I remember thinking, is this really happening? Agonal breathing can sound like gasping, snorting, irregular attempts to breathe, and it can give the impression that someone is still breathing when in reality, they're not breathing effectively at all. And looking back, I could see how easily it would have been for me to actually hesitate in those moments, thinking he was breathing. He's okay. He's getting air. But he was not. Okay. I'm so sorry. My battery just decided to say it was dying when I'm plugged in. I am so sorry.
No worries at all. Take your time.
This is bizarre. When you do everything right, there is always going to be something, which is kind of a lesson because, again, no matter what you do, there can always be something, can't there? When you have everything set up perfectly. Okay, give me my power back. I don't know if I've lost power here.
Oh, okay.
I'm not sure what's going on. I'm so sorry, guys. Truly sorry. Okay, well, let's see if I can get through this without it dying on me. So the agonal, even as a nurse, I was talking about the agonal breathing and how it can completely change, like completely kind of throw what you're thinking and what you're doing. But once I recognized what was happening, that training took over. And interestingly, even after nearly 20 years as a registered nurse, like Gina was saying, I had never performed CPR on a real person before. And in those first few seconds, my brain was rapidly sorting through years of training, trying to make sense of what was happening. And at the same time, there was also this very human part of me desperately hoping I was wrong, hoping he would just suddenly wake up and look at me like I was crazy and ask, "What the heck are you doing?" Because I knew in that moment I wanted it to be anything other than what I knew it probably was. And I can say I didn't do anything with perfection. It wasn't perfect recall of a protocol. It was one simple thought, just go. I never formally stopped to check for a pulse. I was continuously assessing him, recognizing what I was seeing clinically, and reacting almost from a deeply autonomic level from years of training and exposure in healthcare. And because I knew circulation needed to be restored as quickly as possible, I actually started CPR before I even called 911. Not always the recommendation, though. Later, we actually reviewed our doorbell camera footage, and from the moment he walked back into the house with our dogs to the moment EMS left with Mike, it was 12 minutes. 12 minutes had passed. And it felt like an eternity while I was living it. And yet, everything that would determine whether my husband lived or died happened within those 12 minutes. My body knew this was an emergency before my emotions could even fully catch up. And I'll be honest, there is absolutely nothing that emotionally prepares you to perform CPR on someone you love. As healthcare professionals, we train for emergencies, we learn protocols, we practice skills. But when it's your spouse lying in front of you, it becomes deeply human very quickly. People often talk about the chain of survival, and medically, we know how important every link in that chain is. But what really stands out to me now is that that first link wasn't EMS. It wasn't in the emergency room. It wasn't ICU. It was me, a wife standing barefoot in her kitchen, completely alone, trying to keep her husband alive until help arrived. And that's why I encourage people so strongly to learn CPR, not because it makes you fearless. It certainly didn't make me fearless, but it gave me the ability to act anyway. Looking back, I don't think what saved Mike was perfection. It was simply just starting. And I also think it's important to talk honestly about what comes after. We talk a lot about survival rates and emergency response, and those things absolutely matter. But there's also an emotional aftermath for families and rescuers that people don't always see. And for me, there was gratitude, of course, immense gratitude. But there was also exhaustion, adrenaline, fear, processing trauma while simultaneously trying to care for someone I love. In so many ways, life became divided into before and after. But there's one thing I hope people take away from our story. It's that ordinary people really can save lives. CPR truly does buy time for EMS, for advanced care, and honestly, for survival to become even possible. And in Mike's case, the person who had to act was the person who loved him the most. And that's why learning CPR matters so much. It matters for the people sitting at your dinner table, living in your home, and sharing your everyday life. Because I never thought it was going to be my family until it was. And today, I say happy birthday to my husband, who is celebrating his 62nd birthday today, because I'm reminded that CPR didn't just save a statistic, it saved a husband and future birthdays and ordinary moments we almost lost. And that's why this matters so much. Whew.
Becky, thank you so much for sharing, and it's just so incredibly impactful. When we talk about this week being National CPR and AED Awareness Week, we want to empower people to take action and feel comfortable. And as you said, not focus on perfection, right? Because we always say doing something is always better than doing nothing, and you still have that potential to help save a life. So I think your story is such a powerful testimony to the importance of being willing to act. And we are going to talk a little bit about the co-survivorship role that you have. You have a dual role as rescuer, responder, and co-survivor. So we'll talk about that in a bit too. But one question I had for you is, what would you say to people who worry that, if they're in the moment where it is somebody that they love, a family member, a close friend, what would you tell them if they're worried that they might panic or freeze up and just not know how to respond because of the gravity of that situation? Like
First, you will panic.
Yeah.
You'll panic.
Yeah.
In 20 years of training, and I panicked. I processed every single time CPR changed, every time. You will panic. But having the experience and the training allows your body to kick in when your brain is like, what the heck is going on? So it's so important to have that training, because it just becomes automatic. So while your brain is freaking out, while your brain is panicking, your body's going, let's go. We got to do this because we have a life to save.
Wonderful. Well, thank you so much. We'll come back to you in a bit, but
I want to get my charger. Thank you all. Sorry about that.
um, so next up, I'd like to welcome Kathleen, who also saved a life in her home. Kathleen has a really powerful perspective of as both a parent who saved the life of her child as well as a co-survivor. As Kathleen mentioned before, her story began when she heard a sound coming through the baby monitor at night. Kathleen, welcome again, and can you kind of take us through your experience?
Sure. Hi again, guys. And I am also reading off of notes and may get emotional, so bear with me. But my story dates back to April 14th, 2022. It's a date that's forever etched in our memory, whether we want it to be or not. But my son Noah was 10 months old at the time, and he was sleeping in his crib just one room over. I kept the baby monitor like on the nightstand next to my bed, and I woke up after hearing some strange gasping sounds coming from the monitor. So I went into Noah's room, I turned on the light, I saw that his lips were blue, he was kind of pale in color. He wasn't breathing normally, so I picked him up and he was limp in my arms. I noticed that he was having agonal respirations, which Becky described as kind of like a gasping sound with some long pauses in between of no breathing at all. So it was at that point that, he wasn't responding to my voice. I put him on the floor and I yelled for my husband, Steven, to wake up and to call 911. I immediately started CPR at that point, and even when my husband had dispatch on the phone, they were kind of just talking us through how to do it. And I was doing the compressions followed by 2 breaths. And um, like Becky had said too, like in the moment you're a little worried, like, am I doing it right? Am I doing it, deep enough, hard enough? But also I don't want to hurt him. He was a tiny baby at that point. So it's scary. And even though this is all going in my head, I was just in the zone doing what I needed to do. So thankfully, the first set of police officers arrived probably within 10 minutes, and they came up to his bedroom, which was on the second floor. And the first police officer in there actually said to me, like, it looks like he's breathing now. Like, you could stop. Why don't you carry him downstairs? So, listening to the police officer, I carried him downstairs. I laid him on the floor by the front door, but he was still gasping. And just out loud, I was just like, this is not normal. And I just knelt down next to him and I started CPR again. And thankfully, within another few minutes, a third officer arrived. He had the AED in hand, and then the ambulance and EMS crew followed in shortly after. So the medical team took over the compressions and the CPR. They put the AED pads on him, and they did have to deliver a shock as he was in ventricular fibrillation. And that was followed by a second shock shortly after. And while they were doing this, I, for some reason, stood up, went upstairs, grabbed all the essentials that I knew I would need for the hospital, the diaper bag, a change of clothes, a phone charger. Um, and they were able to get Noah stabilized. One of the officers carried out Noah in his arms to the ambulance, and they put him on the stretcher in the back. I was allowed to ride up front while my husband went with another police officer to the hospital. And even while driving there, I recall the ambulance driver took the longer of the routes, and I was like, excuse me, can you please turn around? Like, it's a shorter distance if you go the other way. And even on that ride, I called mine and my husband Steven's parents. I told them what was going on. I texted my boss to say I wasn't going to be at work that day. And looking back, this all seems like very odd behavior, but in the moment, I was just very focused on what needed to get done. And I knew I would deal with the emotional aspect later. I don't know what it looked like to other people at that point, but so when we were at the hospital, Noah was taken to the trauma bay, and we had to repeat to several different doctors what had happened that night. And the question kept coming up about, like, how did we know how to do CPR? And it was at that time that I mentioned I was a former volunteer EMT and that I had had my husband take a CPR class prior to giving birth to Noah. So he was well aware of the process as well. And again, similar to Becky's story, despite being a volunteer EMT for close to 7 years, I had never performed CPR on anyone either. Either it was I arrived on scene and someone higher up was already doing it, or they were using a device called the Lucas, which performs like automated chest compressions. So again, my first time performing CPR was on my own son. So once Noah was stabilized, they moved him up to the PICU. There they did a brain MRI to check to see if he had any damage due to lack of oxygen to his brain from the cardiac arrest. Overall, he recovered fairly quickly, thankfully, and he was able to be extubated the next day and woken up. And upon waking up, he was behaving normally for his age. And the doctors told us confidently that without a doubt, it was the quick acting and efficient CPR performed by myself and my husband that saved Noah's life. And he did not have any brain damage or like deficits either. So that was very surprising to them. But so at the time, they were unable to determine the cause of his arrest, and they suspected it was just due to a virus. So we were transferred to a second hospital where they had surgery and they gave him an implantable cardioverter defibrillator or an ICD. They did limited genetic testing at the time and results were negative. So after that, we kind of just went about life as it was. I guess as normally as you would expect with a toddler with an ICD. But then at 18 months old, he got sick with pneumonia and we brought him to the hospital and it happened again. He had another 3 cardiac arrests over the course of a few hours, this time in a hospital setting. So we were not the ones to perform CPR, but we witnessed it. And we just could not figure out why this was happening to us. This time it was of bradycardic nature, meaning slow heartbeat. So even though he had an ICD, it did not help him at the time. Which is something good to know for the future that an AED and CPR is still needed on someone, even if they have an ICD. So we were told to call our families that night because they did not think he was going to make it. But thankfully, he pulled through again. It was a long recovery that time, but we pushed for more answers and they did additional genetic screening called whole exome sequencing, where they analyzed like all the DNA in the body. And they were able to find out that he had a rare disease called PPA2 deficiency, which at the time of diagnosis in 2023, there was only about 65 cases worldwide. And they said like less than 10 people living with it. So because it is a mitochondrial disorder, it's related to the energy metabolism in his body, and he's unable to break down the energy properly. So when he's sick with viruses or for some reason alcohol, which we don't understand that part yet, but those are considered stressors and they'll put additional stress on the body. And like when your body's fighting an infection, you need more energy, and then these individuals can't break it down. So that largely affects the energy demanding organs like the heart or the brain. So these individuals are prone to sudden cardiac events, and unfortunately, that's often the first sign or indication that someone has this disease. So that was a lot, but fast forward 3 years later, and this is still my life. I can't say that what happened to us was in the past and will definitively never happen again, as with his condition, I don't know. A common cold or a stomach bug or accidentally consuming foods or medicines containing alcohol could cause another cardiac arrest. And as much as I wish I could keep him in a bubble, I can't. Like he's going to go to school. He's been in daycare, but he's starting kindergarten in September. He's going to get sick, and I know that. And I can't control that. But what I can control is mine and my family's ability to be prepared. So after Noah's diagnosis, a bunch of our family members took CPR training. And I mean, my husband and I are due to refresh on ours, but we are CPR trained. And we also have an AED in the house. So, I mean, children experiencing cardiac arrest is not common. And obviously, my son's rare disease is not common. So we've since made it our mission to spread awareness, not just on the disease itself, but on the importance of both having the knowledge of when and how to perform CPR. Because it wasn't just me waking up to the strange noises on the monitor. It was me recognizing that that was not normal breathing. Me then seeing his appearance, him being pale, and that he wasn't acting like himself, to know that at that moment I needed to start CPR. So while I never thought I would find myself performing CPR on my own son, it's not something any parent prepares for emotionally. but it's something that happened. And we know that cardiac arrest doesn't wait for us to be ready. So that's kind of why recognizing the importance of CPR and taking the time to learn it is so important, because what you learn today could potentially save a life tomorrow. That's it.
Kathleen, thank you so much for sharing that. That's just, again, such a powerful story. And, I think just your message to other parents too, that you've shared, like how critical it is to just be prepared and like know CPR, because while nobody wants to imagine having to perform CPR on somebody that they loved, or their, their own child, it could happen, right? There's a lot of, I think, myths and misconceptions that sudden cardiac arrest doesn't happen to younger people, but in reality it does. And so the preparedness piece is so critical. And so I thank you so much for all of your advocacy and raising awareness of that importance for families and parents to do. So thank you. I have a follow-up question for both Kathleen and Becky, because you both stepped into take action to save somebody that you love. But so you're rescuers, of course, but you also carry that emotional experience of that, beyond that moment, right? Into your lives as moving forward after the sudden cardiac arrest. So as co-survivors, can you share a little bit about what that journey has looked like for you? And I know you've both alluded to, the emotional component of being a co-survivor. But what does co-survivorship look like for you? And, how do you kind of explain that situation, or kind of share your feelings on, your from that perspective as well? Maybe I'll jump back to Becky if you're back, you want to comment.
I didn't want to jump over anybody. I'm back and I have power. So thank you all for your patience. I'm so sorry. Yeah, for me, I'll be honest, trauma. I think that when you have a loved one that experiences this, when you have anybody that experiences this, they're not conscious. And my husband says this often. He's like, I wasn't really there. It was just his body. It was me who had to process, and still processes, and will probably always process what happened that morning, thinking of every moment, every step I took, everything that I did. And I will say, for those who might be in the audience whose outcome wasn't as good, I know that you even probably further think of those moments. But I need everybody to know that you just have to do the best you can. There's never a guarantee on anything, but there's even a less guarantee if we don't know what we're doing, which is why CPR and learning CPR is so, so important. But no, I have my moments, many of them. And I'm just proud of being able to talk to people through foundations like the Sudden Cardiac Arrest Foundation, because more people need to get trained and understand that it could be their loved one tomorrow.
So, I kind of agree with Becky too. And it's not something that you moved past. It's something that you just continue to move forward with. And like, while I was kind of acting on instinct during the cardiac arrest itself, grabbing my purse and my insurance card and all the logistical things, it wasn't until later that the emotional aspect hit me. And it still does 3 days later, as you could tell, by me getting emotional. And it comes in waves, like relief that Noah survived when I know many do not, but also fear because of his condition that it can happen again. So people always think of the patients typically in these scenarios. They say the patient had a cardiac arrest. How are they doing? But it really is a big emotional load that the rescuers carry, whether it's a good outcome or not. It's something that's kind of with you for life. So.
Yeah, absolutely. It's so important to recognize that sudden cardiac arrest affects certainly the patient, but then the whole family and everyone that cares about them, becoming co-survivors in this journey. So we do have a program called the Cardiac Arrest Survivor Alliance, which I'll share the link for later, but that's an option for anyone who's affected by sudden cardiac arrest, whether survivors, co-survivors, responders, or advocates. So I'm happy to share information about that in a little bit too, for anyone that would like to learn more about that or join us on that in that program. But thank you both, Rebecca and Kathleen, for sharing. I'd like to introduce our next guest now. We're gonna shift gears a little bit into a different setting and different perspective from a school environment. So we're joined next by Stephen, who responded to a sudden cardiac arrest emergency at his school, where at the time, as he shared, he was the principal and had recently completed CPR training. And so Stephen's experience really highlights for us how training can help with preparedness and be able to help to save a life. So Stephen, thank you again for being here. Can you share a little bit about your experience and how your training had also influenced your response in that scenario, in the case?
Yeah, absolutely. So on September 22nd, 2023, as I shared earlier, one of our students at Art Freeler School, Heather Freely, when the time was in the 8th grade, went into sudden cardiac arrest during her 4th period Algebra 1 class. We had received a call in the office from the classroom, from one of the students on the classroom phone, that had said that one of the students in class had fainted, which isn't an uncommon response to see or to have if you see somebody, slump to the ground. And in school settings, it's not normal. I certainly don't want anybody to think, oh, kids are fainting every day, but it's not uncommon. Right? A school the size of Art Freeler, which sits between 750 and 800 kids, we're working with human beings. So we've got that many kids and about 100 adults overall on campus. So things will happen. People do faint. People do have low blood sugar. There are times where you'll have a student that has a seizure. Sometimes a student is sleeping. So there are times where you're going to get a call in a school office and you're going to receive something like this, and somebody's going to be expected to respond. And that day, it was me. So in heading over to the classroom, with it being such a large school, serving students that are in transitional kindergarten who are 4 years old, all the way up to 8th grade at 13 years old, lunch takes place for those grade levels over the span of about 2 hours. So at the time, our 2nd and 3rd grade students were out at lunch with our 2nd graders out on the blacktop and our 3rd graders inside the cafeteria. And just happens that the pathway from the classroom that Heather was in, from the office to the classroom, I'd walk through our main patio area, and one of our behaviorists on campus was out there having a conversation with one of the students during lunch. I don't think the kid was in need of social emotional support at that time. He was just doing his job and building relationships. And one of the things I had done that I wanted to make sure I was in the habit of doing anytime I was responding to a classroom for anything is if there's somebody along the way that I can bring, I do so. So I'd asked our behaviorist just to take a walk with me over there just to see what was going on. And that ended up being a really wise move that day, because when I got to the classroom, right away I could see that the feel was different than, oh, hey, a student fainted, or, oh yeah, they it was clear that there was something big going on, even though admittedly I didn't really know what I was saying at the moment. Our behaviorist, one of the very first things we had done was I'd asked him to take the students that were in that classroom and just remove them from the class and just evacuate them somewhere. So he had taken them to another classroom on campus, with the exception of 2 students who were in the classroom because they'd used one of their cell phones to call 911, which was another key point in making sure that everything really fell in line and went right that day. So those 2 students, they were already on the phone with 911 with the dispatcher. And after I got my bearings about what was taking place and what I was saying, and given some immediate direction over the walkie just to make sure that we were going to keep kids off the blacktop and clear the blacktop of the 2nd graders, keep the 3rd graders inside. So after we had done that, And I'd taken the cell phone and, like I said, kind of got my bearings about what was taking place and what was going on. I believe it was referred to earlier by both Becky and Kathleen as agonal breathing, if I'm saying it correctly. Um, I I've struggled with how to say this um, without just being just very direct, but I've never been there when somebody loses their life. I've never seen that moment. I know over time, eventually, I will be at that spot. Both my parents are living. My wife's mother still alive. I know at some point I'll be there at somebody's side when they take their last breath. But I haven't had that experience, so I didn't know what I was hearing. But I'm so thankful that our 911 dispatcher that we had on speakerphone did, because I know as soon as I heard that gasp, I can still hear the dispatcher in my head saying, "Okay, well, we're going to begin CPR now." And as she is talking me through the steps that I should be taking to begin CPR, I had already started. Just about 2 weeks before Heather had gone into her sudden cardiac arrest, all of our administrators within our entire school district had completed our CPR training. All of our administrators were required to keep that training current. So had gone through that. So very much how both Kathleen and Becky were sharing a little while ago, very much it becomes like automatic. I really had that same feeling, right? So much so to where as I'm doing chest compressions, I can really, in my mind, picture the same dummy that you do the training on, and being very conscious of keeping the right pace, hearing the metronome in my head, in addition to having the dispatcher counting out 1, 2, 3, 4, 1, 2, 3, 4. Even so much so to where the training that we had received, we were instructed to give 30 chest compressions and 2 breaths. So I had already given 2 breaths by the time that she had finished her description about what I should be doing. So as I'm doing chest compressions, I can feel that as she's counting 1, 2, 3, 4, that I've clearly gone over 30 compressions. So I remember asking, should I be doing breaths now? At the same time, I'm continuing to give compressions. And she says, just keep going, 3, 4, 1, 2, 3, 4. So I continued chest compressions at the same time that a couple of things were taking place. Number one, our team across the entire school did an incredible job. Whether it was the cafeteria team keeping the third graders in the cafeteria until given further direction, our yard supervision team who had shut down lunch recess early, I should say, for the second graders to get them back into their classroom. And our office staff and assistant principal as well, who made sure that we didn't have any of our other grades, because fourth grade lunch was coming up pretty quickly, had just given the instruction to stay in the classroom. The technical term for school and their emergency response in that situation, what we had done was a shelter in place, which many times our families or our children, we will go through lockdown drills, which are response to an immediate threat on the campus, the safety and lives of others. A shelter in place is very much the same process with 2 exceptions. Number one, there is no immediate threat to the overall safety of the campus as a whole, which was true in this situation. There was an immediate threat to the life and safety of Heather that day, but overall, the entire campus, minus her, was safe. And the other difference in that shelter in place is that a classroom can resume their normal activities. They're not expected to turn off the lights and hide. They can continue to learn. We had at one point had done controlled bathroom breaks for classes as well. Really temper the flow to make sure that we don't have kids out and about and all over campus, but we can still operate as normal as reasonable. But that was taking place in the background. And a lot of those things I can't see in the moment, but I hear after the fact, and so thankful that we had so many people that made a lot of right decisions and choices that day. And the other thing that was taking place also is that our emergency response was arriving to the scene. I don't know how long I was doing chest compressions. I know, Kathleen, I believe you mentioned going back and looking at the ring camera. I had access to the school cameras to timeline it out and see what happened, and I never chose to go back and take a look at it. I do remember having a point in my mind where part of our CPR training, they talk about how it's normal to feel tired, to feel exhausted, and I remember never really feeling the type of fatigue or out of breath that I expected. But I also remember having a mindset of like, I am going to have to slump over next to stop me. Like this is something I will continue as long as needed. And when emergency response had arrived in the classroom, I remember thinking that I just have to just keep on going, just continue, as what they were doing on their end was clearing desks out of the way because it's still set up like a classroom. There are groups of four every 4 feet or so in there. They were clearing as much space as possible, up until the point where one of the officers had come up on my right side to take over compressions, and I knew from that moment my responsibilities in that classroom were finished. One of the things I didn't mention was the classroom teacher was right there by my side the entire time. She was holding the cell phone and had played a role in answering a couple of questions for the dispatcher on the phone as well. After we left the classroom, there's kind of just this moment of just you have like, for me, I would almost feel like, I want to say it was almost like a release, but not in a good way of like a relief, but just like, okay, well, okay, I'm finished with that, and kind of just say, okay, well, what's next for me? What's to do next? For me, my role of what was next was to find out exactly where we were at in terms. I can step out of the classroom and see there's nobody on the blacktop, and figure that the second graders are in class and the third graders in the cafeteria, but kind of just get oriented in regards to that. And then from there brought our school team together, including representation from our school district at that point as well, who had arrived to figure out what we're going to do next in regard to something as simple as, okay, well, the lunch schedule is off. What are we going to do to feed all these kids? All the way through to more detailed things in terms of organizing social emotional support for any of our students who may need it, because we did have close to 30 students who witnessed a cardiac arrest taking place right in front of them, all the way through family communication to the community at large, and then ultimately catching up with Heather Freeley's family as well in terms of updates as well. So a lot of logistics and planning on that end, but I think so many things went right that day, and much of it is the grace of God. But much of it also is preparedness and by design. Because we practice emergency drills like a lockdown drill, our school collectively is very ready to move forward with a shelter in place. Because one of the things that we would do with our older students as a part of our lockdown drill is we would practice what a lockdown drill looks like in the event it's the middle school lunch. We would not go through that with our younger students because of being conscious about not wanting to teach our youngest kids that, hey, sometimes you might have to go run and hide in a classroom when you're on the playground. But because we had gone through that process with our older students, our yard supervision and cafeteria team knew what to do for our younger students in terms of what actions needed to take place. Our office team knowing, what information to pull for emergency personnel that arrives right away in terms of it's called the demographic screen, and it's parent contacts, address, health history, things of that nature. So many things that as a principal, ultimately I'm responsible for, but I don't have to be the one to enact. And on that day in particular, I never had to call for it in the sense of like, hey, let's make sure we're printing out the demo screen. Hey, let's make sure these kids go to their classroom. It would, because of the preparation we had leading up to that point, those things hit and took place. There's nothing in our emergency response plan that says things like, hey, make sure the behavior is just standing right here at all times in case of. That is very much the grace of God in those moments. So it comes from the family, and certainly not from me or the school, that the two of the students that were in the classroom called 911 as soon as they saw that something was taking place and something was off. So a lot of things lined up and went right that day. And it comes from our training and our practice, and that it certainly ties to the CPR training that has taken place. Like I said, I could hear not just the metronome, but the clicks of the dummy when you are getting deep enough, and having that experience so close to Heather's cardiac arrest provide more value than I think at times even I give it credit for. But also what allowed things to go right in Heather to receive the immediate response she needed so that she can thrive in the way that she is today. Came from an entire school of cafeteria supervisors, yard supervisors, teachers, office staff, and about 750 kids deep, of making a lot of good choices to ultimately get to the point where Heather's got opportunities in front of her now, whether it's with the Sudden Cardiac Arrest Foundation or a variety of other things that if we're not as prepared, or if things line up a bit differently, outcome on that day could have been very different. So very grateful for the training that I had received, very grateful for the response that our collective staff and kids had that day, and excited to keep up with what Heather has next in her adventures.
Thanks so much, Stephen. That was wonderful. And for those who, if you didn't watch our earlier webinar this week on AEDs and communities, Heather was actually a guest panelist on that. So it's really special to be able to have Heather on one webinar and Stephen on the other. And to just see the amazing advocacy work that Heather has taken on after her sudden cardiac arrest. So thank you, Stephen. And one of the follow-up questions I have for you, you spoke so much about all of the different like logistical things and all of the people and managing, both the logistics of like lunches and then also the emotional impact on children that may have witnessed, what was going on. For you as the principal and this figure of responsibility who has so much on your plate, but also as the rescuer, like at what point were you able to how did you kind of unpack all of that emotionally, like because you were dealing with so much, and kind of what does that look like for you, in your response and in your experience as a responder, in your role?
That's a good question. It's admittedly, the couple of the stories we heard just a little while ago, the connection that we're going to have to a spouse or a child is different by design than the connection we're going to have to a student. I don't want to say that and have anybody hearing think that as a principal I don't care about our kids, because I certainly do. I say that the kids at our school, they're not just our students, they're our kids also. They might not be our children, but they are our kids, right? And I've always been very aware of the fact that when our schools send their children to us, that they're trusting us with their kids. So we take that really seriously. What's part of my response been, part of it's been the typical guy response, just bury it deep and just don't ever acknowledge it ever again. But that's not completely true. I can look back, about 2.5 years later now, and really look back on that day with a sense of pride about just how everything went so well that day, and collectively how we were able to save Heather's life. But to get to that point, there certainly is a roller coaster, So one of the things that I would encourage anybody that's listening is that when traumatic things happen on a school campus, check in on the principal. That doesn't typically happen. Just somebody just checking in, just making sure they're okay and seeing how they're doing. In another instance that we had that I won't go into detail about, I can still clearly remember there was one student in particular who is the student that you wouldn't expect many times would show empathy for somebody else. Just our kids are sometimes struggling to make good choices. But she was the one who came to me and was like, Mr. Theall, how are you doing? Are you doing okay? And while I won't share the story or her name that day, like that will stand with me for the rest of my life, that she made it a point to come to me and make sure I was doing all right. uh, while you can't see behind me right now, I do have a card that a family who's almost completely disconnected from Heather's cardiac arrest, a card that the family had written me, was basically just expressing their gratitude for what I had done and what the school had done that day, and how it really just instilled a level of trust for them and their family, for their children as well. So yeah, it's the emotions are different than if it's your immediate family, but they do exist. It's like I said, I can look back today with pride, but yeah, there's the wave, there's the emotion of fear and anger and relief and gratitude and doubt and 100 other things that I know I haven't mentioned.
Thanks, Stephen. Before we transition to our next presenter, I did want to just note that we did set this webinar to be a little bit longer than our typical hour because we have so many wonderful perspectives and speakers to share. So we're going to go until about 2:20. So please do stay on with us as we still have another speaker, and then we're going to do the Q&A session. So I just wanted to welcome next Shannon Walter, who shared earlier, who responded to a Pulse Point alert. And Pulse Point was actually one of our guest presenters on our other webinar this week as well. Really, Shannon's story helps to demonstrate how technology and preparedness and community willingness to act can come together to help to save a life. So Shannon, please, welcome, and please share with us your experience about that day. And also, can you give us a little bit of background on why you, what made you decide to join the Pulse Point app and put, and kind of give us your perspective on that too? That would be great.
Yeah, thank you. I just wanted to start by saying thank you to the other panelists. As a wife and as a mom, and as somebody who works on a campus and has spent my entire career dedicated to working with children, we have a couple hundred children that live on campus here with us now. Your stories were very powerful and very impactful, and I want to thank you for your courage and your vulnerability. My name is Shannon, like Gina said, and I'm taking the community responder perspective and kind of technology perspective. We are very lucky in our community to have our county subscribe to something called Pulse Point. And I was probably one of the first to know that our community had subscribed to this. Like I said earlier, I had been a Heart Saver instructor through the American Heart Association for many years prior to performing the CPR, which I'll talk about in a moment. And the hospital that my CPR certification that was connected through, when I was going through my very first CPR training to learn how to become an instructor, my instructor at the time had mentioned, we are getting this app, and I really encourage you to download it. So that is how I was probably one of the first, and in every of the countless people that I trained, throughout my time as an instructor at my previous job for over 10 years, I always shared, I taught multiple classes a year, and I always shared about the Pulse Point app and how lucky we were to have such an app in the community. I'll share a little bit about my story. Like I had mentioned, I had been a CPR instructor for many years, but had not performed CPR before. So my story was back in October of 2023. I was finishing up my lunch. I was just kind of sitting in a parking lot, just a little ways from work. I had a really important meeting that I had to go to. So I was just trying to get away from work, decompress before I was going to meet my new supervisor. My job had been transitioned to a new supervisor. So I was kind of just mentally preparing for that and just sitting in a parking lot, eating my lunch. And on my way to that meeting, I got an alert on my phone. It makes a very loud noise. It's very unexpected, and it said CPR needed. And then about 2 seconds later, there was an alert popped up that showed where the emergency was. And prior to this, I had I think 2 or 3 other alerts that had come through on my phone. But by the time I had gotten there, EMS was already on scene. So I would always just mark, I think it was EMS already had arrived or something like that. You touch it on your phone. So when I got the alert, I was directly across the street from where this emergency was happening. So I drove over there not knowing what to expect. And when I pulled, it said it was at like a Dollar General. So I didn't know if it was going to be in the store, outside of the store, behind the store. It was in like a strip mall. And so I got there and I could see a gentleman he was on the phone. So he had his like cell phone in his ear and he was pulling somebody who was unconscious out of a vehicle. So I ran up and assessed the scene, made sure that he was in fact on the phone with 911, and to ensure that they had been called and that somebody was on the phone with them. I asked if he was a known drug user, because I did have Narcan with me. And then assess the scene, ask somebody to go grab an AED, and assess the scene and started CPR. It was really amazing. Once again, I had not done CPR on a human before, and my training just immediately kicked in. I think Stefan had said like you like thought about like the like rhythm and like you were like counting in your mind and like you were breathing and like the agonal breathing and like I remember him gasping and I kept thinking, you know, my gasping is not regular breathing. Gasping is not regular breathing. Like I repeat that in my class like over and over again. And so I did CPR for probably, I don't know, 3, 5, 7 minutes, something like that. When I actually started CPR, I could hear the sirens in the background. What I didn't know at the time was that we have a really bad issue. I don't know how to explain it any other way. It's a really, really large issue that when you are in certain areas of our community, you cannot reach 911. What 911 is supposed to do is it's supposed to read like the signal and direct you to like your closest like 911 operator. And we have areas in our community that cannot reach 911. And so what I did not know is that the individual who was with the victim was actually down the road about a quarter of a mile maybe, at an apartment complex when he realized that the victim had slumped over and was unconscious and tried to call 911 about 4 times from that parking lot at the apartment complex and was unable to get through. It just would not route him to the operator. So with the victim unconscious, he drove up the road to the Dollar General, pulled over. I don't know why he picked the Dollar General. I don't know if maybe he knew about 911 not being called, if he just thought maybe he wasn't getting a good signal. I don't know what made him stop there. And then he was able to reach 911 there. So by the time I actually got there, although I got the alert right away, he had actually been without CPR for some time prior to that. Completed CPR, EMS got there. The victim was incredibly lucky that they knew it was a cardiac arrest emergency, and we live in a community where we have very specialized care, and they sent like the specialized EMS vehicle. They had stuff on that ambulance that a lot of ambulance services do not carry. So he received, you know, hospital level care on scene. It was very incredible. And they got him, you know, once they were all set up and ready to go, they took over. I spoke with an officer before I left. I spoke with the gentleman who was on the phone. I didn't know the relationship at the time. But just to make sure that he was, you know, doing okay. He was very distraught and like on the ground and crying. And I talked to him for a few minutes. After that, I got back in my car, and went to work, and went to my meeting that I had, my important meeting from earlier. What I thought was really interesting, before I had left, we had 2 other people who had come by and ripped Narcan boxes open and handed them to bystanders. So at the scene, we had 3 like open Narcan canisters available, which I thought was really amazing. It's not what we needed, obviously, in the event of this emergency, but just a little plug for Narcan as well, and the importance of having Narcan in your community. Trying to think where I left off here. I left the scene of that knowing that I would probably never know. I did not know this person. I would never know the outcome of whether or not that individual survived. so I just went about my day, and I prayed that he got the care that he needed, but I knew it was very unlikely. We know that sudden cardiac arrest survivors, many times statistically do not survive. But I did know that I did everything that I could possibly do, with the training that I had, to possibly increase his chances of survival. And then about a couple of days later, I was in Dallas, Texas. I'm in Illinois, but I was in Dallas for a conference, and I was waiting for my friend to get ready. And I saw a post on social media. The individual who was the victim was actually kind of a local celebrity here in town. He works at a pancake house. He's our coffee guy. And they were looking for the nurse who was on site performing CPR. And I very quickly was like, I need to address that. Like, I'm not a nurse. I am a community responder. I'm a CPR instructor, but I am not a nurse. So when I did get back in town, I went and talked to them, and I just explained who I was. And the outcome of him having survived was amazing. And it reinforced in me my belief in everyone needing to be CPR trained. And if you see something, do something in the community response. And in this case, technology, we have the Pulse Point app that is active in our community. And it showed me how powerful ordinary people like myself stepping forward can impact someone's life. So once again, I'm not an EMT. I'm not a firefighter. I'm not a nurse. I'm not a police officer. I'm just an ordinary person who had CPR training. And prior to that day, I had never completed CPR on a real person. And most rescuers do start as ordinary people. So I hope that people can take away from this webinar, to, if you see something, to do something, and at least temporarily try to put that fear aside. We are not perfect. What I did that day was not perfect. But that just the simplicity of being willing to step forward and help somebody in need. So that day taught me that obviously technology can connect us and training can prepare us. And ultimately it can save lives, as you've heard from all of the panelists. The person experiencing cardiac arrest doesn't know the job title, or in Rebecca's case, like her husband said, like, I wasn't even there, it was just my body. They don't care what your job title is. They don't care what your credentials are. They just need somebody who's willing to help during those critical first moments. So if there's one thing I hope that people can take away from my story, it's that take the class. I can't tell you how many people I trained over the countless hundreds, thousands of people that I certified over the years, that said, the reason I'm in this class is because I was in an emergency. My husband had a sudden cardiac arrest. My student had a sudden cardiac arrest, and that is why I'm here today, taking your class. So take the class, learn CPR. If you have an app in your community, download the app. And if the day ever comes when someone needs help, please choose to do something rather than nothing. You never know whose life you can help save, but I can tell you from my experience that those first minutes truly matter.
Thank you, Shannon. There's a follow-up question that was placed in the Q&A, so I'm gonna ask it to you now, because I think it's a great insight. How has your experience providing CPR impacted how you teach CPR?
Yeah, that's a really interesting question. I don't know that it's necessarily changed much in the way that I just, other than the fact that I do just have a personal story. I was always a very passionate CPR instructor. I love teaching CPR. I think it's one of the most vital skills that anyone can learn. And just CPR and first aid and being able to help people in the event of some sort of medical emergency. And so I think that it increased my passion and my desire for everyone to learn CPR. And I've had the ability to, write some like articles through like foundations. I've had this opportunity with the webinar. And it's just really meant a lot to me to be able to continue to spread and encourage people to get certified. But I've always been a very passionate instructor, and I love teaching. It's not actually something I get to do anymore at my current job, but my passion for CPR and getting the knowledge of CPR in as many people's hands is still there.
Great. Thank you. So we're gonna transition to the general Q&A session now. So feel free to type in your questions in the Q&A. There are a couple already, and I do have some that had been pre-submitted. And I just also want to let you know, for all of our panelists, there's some really nice kind words in the chat. So make sure that you see what folks are saying to you in there too. Really wonderful messages of gratitude and so thank you. So this first one is for Stephen. So it says, first of all, great job to you and your staff for Heather's Save. How often does your school do a review of its emergency response plan, and how often does your school conduct drills on campus separate from trainings?
Yeah, so our schools review their medical emergency response plans annually with their staff and along with their entire school safety plan as a whole. And then also all gets approved by their school site councils annually, which is a combination of the school site leadership, teachers, classified staff, and parents/community members. So that review takes place annually. And then in regard to cardiac emergency drills, I know I was referring to like lockdown drills that we would do earlier. While we don't have explicit cardiac arrest drills yet in place, I know that there are some reworks and revisions to our school safety plans as a whole that are in the works right now for rollout sooner rather than later. I can't sit here and say for certain that I know that that would lead to a change in what drills are ran as well, including cardiac arrest drills. But I can certainly see that on the board. So more to come. In my new role, I'm very removed from those conversations, much more aware it's happening rather than leading it. But I think that the experience that we had at our school, I think certainly highlights the importance of making sure that your response plan, either on paper, in practice, and in reality, are all aligned.
Great, thank you. And a follow-up question to that is, do you have AEDs on campus?
Yeah, so the timing is amazing. So yes, there are AEDs on every single campus now. We did not have an AED on campus at the time of Heather's cardiac arrest. In the state of California, any school that hosts interscholastic athletics, which is almost exclusively our high schools, is required to have an AED on campus within 2 minutes of walking distance of anywhere where those events would be taking place. But in the state of California, it's not required that all schools have them. Just because it's not required doesn't mean a school can't. So at the time of Heather's cardiac arrest, we were in the process as a school district of reworking our cardiac arrest emergency response plan. And so written into that very shortly thereafter was the inclusion of AEDs on every single one of our campuses. The timeline from Heather's cardiac arrest to approval to install was as quick as possible. It was approved within a month, 6 weeks of, all the way through the school board of being in the response plan, ordered shortly thereafter. Some delivery delays prevented us from installing during that school year, but they were all installed and accessible in August of 2025, which is start of this school year. Oh, last school year. I got my timelines off a little bit. August 2024 it was. Heather's cardiac arrest was in 2023.
Great, thank you. Another question that came in, so this came in while Becky was talking, but I'm going to ask it to everybody, and I know we've touched on it a little bit for some of you, but thanking you for your powerful story sharing and wondering so for Becky, how your husband is doing, how was his recovery process, and I'll ask the same to Kathleen as well.
My husband is doing absolutely amazing. Absolutely amazing. He did leave the hospital with Azole Life Vest, which is the same manufacturer that makes our AEDs. So we were fortunate that he was able to do that and get that coverage while we waited for a permanent ICD to be placed, which was placed in March. He's going to cardiac rehab. I believe he's currently mowing our lawn. Nothing is going to stop that man. And he's doing absolutely amazing. Absolutely amazing. He ended up, because CPR was started within 30 seconds of him, his sudden cardiac arrest happened. He went down. I was standing right next to him. I actually was able to catch his head before it even hit the floor because I was literally standing next to him and instinct just happened. And CPR was started within 30 seconds. So he has absolutely no deficits whatsoever.
Amazing. Thank you. Kathleen, I know you touched on this a little bit, but do you want to comment any more about how Noah's doing today?
Yeah, Noah's doing well. He's actually turning 5 in a few days, on Monday. So, I mean, that's exciting in itself. It's kind of like, you made it to 5 years after having 4 cardiac arrests and this rare disease. So it feels a lot bigger than it might to other people, celebrating all he's been through. But he's doing well. Like I said, after his first arrest, 10 months old, he recovered quickly. And then his second set of 3 arrests was in the hospital setting. It did take a little bit longer to recover. He was on like a heart medication for a while, but his heart function is perfectly normal now. He's not on any medications. So we kind of just take things by the day by day. If he gets sick, we go to the hospital right away and they'll monitor his heart, and make sure he's not at an increased risk for the cardiac arrest. But otherwise, yeah, he's almost 5-year old with the attitude, loves to play. And, we're just thankful for acting that morning and waking up to the baby monitor, because otherwise our story would be a lot different.
Yeah. Thank you so much. And I will put in a plug to visit our Sudden Cardiac Arrest Foundation social media, because Noah and his adorable little sister did a video for the campaign and the importance of CPR and learning how to use an AED, and it's adorable. So please go visit it. It's so cute. So thank you, Kathleen, for all of your advocacy and getting them involved young too, to be little heart champions.
Thank you.
So we are just about at time. I just wanted to wrap up with first, I just wanted to thank you all so much for joining us today, sharing your stories. This has been such an impactful hour and 15 minutes of I think for everyone, and it's just been amazing. And we thank you so much for sharing your vulnerability with us and sharing your perspective. And I am confident that it has been so inspirational and so impactful for everyone. So thank you for joining us today for that. So I'm gonna kind of just share my screen quickly here so I can close out with a couple of announcements and some information. Okay, so it's still CPR and AED Awareness Week. We would love for anyone that is joining us today and to share this with your friends. Take the It Starts With Me pledge as part of the campaign. It's really a way to show to make a commitment to learning hands-only CPR, which is a great point of entry for anyone who may not know CPR, to learn the basics through hands-only CPR, which can be a great foundation to learn how to do chest compressions, learn how to use an AED. So this pledge is really making your commitment to do that. Once you take the pledge, we will send you an email with lots of different resources to help you in your journey to do that. And if you've already been trained on CPR and how to use an AED, you can take the pledge and indicate your willingness to share that knowledge with other people. So please do join us in the pledge. And my computer is not letting me advance. Sorry. Oops. Wait, it was. I'm so sorry. Technical issues, everybody. Oh my gosh. I apologize. Give me 1 second. Okay. And then, so after the pledge, also you can head over to this QR code, and we are grateful to our partner Zoll for joining with us to host an AED giveaway this week in honor of the It Starts With You campaign. So there's a QR code here. You can scan it to register. We're giving out 2 AED devices to recipients. So please do go ahead and register for that. And for those of you who may be feeling inspired to do more and get involved, I would invite you to join us as a Heart Champion. Our Heart Champion program is our volunteer advocacy program. We provide you with lots of different tools, resources, and support to raise awareness in your community. There's lots of opportunities, lots of latitude, depending on what you're looking to do and your just different opportunities. So please do sign up to do that, and you can get access to our Champion Toolkit as well as additional resources and communication. For those of you, I mentioned I was going to talk about CASA. So for those of you who are impacted personally by sudden cardiac arrest or know somebody who is, please share this resource. This is our Cardiac Arrest Survivor Alliance. It's an online peer support community, and we have over 2,200 members of survivors, co-survivors, rescuers, and advocates. So please know that that is a resource, and we would welcome you to join that. And then finally, there's some different ways here to get involved and stay in touch with the foundation. We have a couple of other events coming up throughout the next month or so. Our next upcoming events are listed here, so you can learn more on our upcoming events page. And I just wanted to thank you all again so much. Thank you to those who are attending and joined us today, and another big thank you to our panelists. Thank you, everybody, and I wish you all a great afternoon. Bye-bye.